Hello everyone, myself Dr. Kanchan Sharma and welcome to my YouTube channel. So today's topic is fibroid in uterus. Yes, fibroids are so common nowadays, even more than 1 million cases registered per year in India. Yes, it's true. Women usually have fibroids in their 30s, 40s and early 50s, not after 50 or in their menopausal age, because after menopause they usually get shrunk, but it can appear at any age. But before starting the video, I really want to share two good news with you. Why good news? Because I believe and I'm still learning that we have to be positive and look on the bright side. So the first good news about fibroid is that they are non-cancerous tumor. There is no danger of cancer in that. And the second good news is that we have in Ayurveda very effective treatment which is side effect free for fibroids. So nobody wants hormonal pill and surgery in fibroids, but they have to go through with these. Hormonal pills have lots of side effects and nobody wants surgery unless it's an emergency case. So in this video, I'm going to tell you what is fibroid, what are the causes, what are the symptoms, and at last I will share very effective Ayurvedic treatment with you. So let's start the video, but please do subscribe my channel and hit the bell icon to get updated with all my latest videos. So the uterus is pear-shaped upside down female organ. And uterus is made of three muscular layers. The outer one is perimetrium, the middle one is myometrium, and the inner one is endometrium. And usually fibroids appear in these muscular layers. So if fibroid develop in the outermost layer, it is called subserosal fibroid. If it develops in the myometrium in middle layer, it is called intramural fibroid, and this is the most common fibroid. And if it develops in the lining of endometrium, fibroid is situated in the uterine cavity, then it is called submucosal fibroid. And submucosal fibroid usually create difficulty in bleeding, infertility problems. So you can see the shape, the location and the size of a fibroid can vary. The first and obvious questions that comes in patient's mind, that why I am having this fibroid, what are the causes? So in modern science there is no exact cause, okay, but in Ayurveda there is a clear reason. Yes, there is a description, there is a clear reason. So the kapha dosha imbalance is the reason. If your body having kapha dosha imbalance or your kapha is increasing, and there maybe vata is also involved in some person, but the main dushti is of kapha, and in Ayurveda we call it garbhashaya granthi. And there may be some associated factors also, like if in your body the estrogen is increasing, your hormonal levels are not good. If you are obese, if late puberty, in early puberty, if there is any family history, any genetical history, late marriages, so these maybe also can play a role in growth of a fibroid. So if you have small fibroid, it is not necessary that you feel any kind of symptoms. Mostly in small fibroids, patient is asymptomatic, and accidentally, like you are going for ultrasound for any other reason and you got this news that you are having fibroids in your uterus. So usually they are asymptomatic, but if you are having moderate or large size of fibroid, you may experience painful, heavy, irregular bleeding. And because of that, patient is usually anemic, and patient feel weakness, palpitation, and other than that you may feel a fullness in lower abdomen, like there is something in your lower abdomen. Frequent urination is other symptom, constipation can be there, or a low back ache is there, heavy vaginal discharge is there. So these are the symptoms. So with these symptoms, when you go to your gynae, they usually examine you by manually. They will do per vaginal examination, and they can advise you for ultrasound to know exact location and size of the fibroid. Now let's talk about the Ayurvedic treatment. In Ayurveda, diet plays important role. So first we will talk about the diet. So we have to take that kind of diet which is not increasing your kapha dosha, because kapha dosha is the reason. So I am going to tell you what you have to avoid. So you have to avoid refined flour, refined oil, refined salt, refined sugar. Avoid caffeine, avoid alcohol. Avoid smoking also. Avoid excess intake of yogurt and dairy products. You can only consume cow milk. That should be pure. Okay, avoid eating very sugary things, very salty things. If you are eating fruits, don't eat a very sugary fruit, and if you are taking those like banana, mango, take in a limited amount. Well, try to avoid non-veg diet and accept honey, avoid all the sweeteners. Prefer multigrain flour, multigrain atta rather than a plain flour or maida. Prefer brown rice, red rice than white rice. Prefer soaked almond, figs, pumpkin seed, flax seed, sunflower seed rather than heavy nuts like apricots, cashew and pistachio. And at last, my advice is to add some spices in your diet like cumin, carom, cinnamon, ginger. Try to add all, spices in your food because it decreases the kapha dosha, and usually kapha dosha is increased if you are having fibroids. So these spices will help you. And now let's move towards the yoga and lifestyle modification, because this is also very important, and some patients actually follow these yogasana and lifestyle modification and they shrink their fibroids. So my first and very important advice is that never ever do day sleeping because it increases kapha. So my second advice is try to avoid stress. I know it is very tough, it is easy to say, but you have to avoid stress. It is very necessary. And the third thing is that unlike Western countries, exercise exhausts the person. In Ayurveda, we believe in yoga. We also believe that some yogasana release energy of the body and they are really helpful in shrinking of fibroid. So there are 4 yogasana which I am going to tell you, which are very helpful specifically for fibroid. The first one is reclining butterfly. The second one is reclining bond angle pose. The third is malasana, and the fourth is standing forward bend. So you have to do this for 30 to 45 minutes. These are really helpful. And for mental peace, you can also go for Bhramari and Anulom Vilom. Because fibroid patients usually have bleeding, or they feel anemic, or they are obese. So I can't say that go for an exhausting exercise, rather than do this yogasana religiously and they will give you results. Because every person is different. In Ayurveda, we have to analyze the Prakriti and dosh imbalance of the patient. So if you want to book an Ayurveda consultation with me, you can book by this WhatsApp number. But now let's move towards the generalized treatment of the fibroid. So the first preparation is take Giloy Sattva 500 mg. Take Shila Sindoor 50 mg and take Praval Pishti 125 mg. Mix it well, mix it with honey and take it half an hour before your meal, before your breakfast, before your dinner. The second preparation is Kanchanar Gugul. The third preparation is Chandraprabhavati. Take both of these 2 tablets twice a day after half an hour of your meal. You have to take this with ginger, cinnamon, water. How we can make this water? It is very easy. Take half inch of ginger, 1 inch of cinnamon and put it in 1 glass of hot boiled water and leave it for 1 hour. Then filter it. This is your ginger cinnamon water is ready, and take those tablets with this water. So the fourth one is Varanadi Kashaya tablet. This is also very effective. You have to take all these 4 preparations together. So take these treatment for 2 to 3 months and definitely your fibroids will be shrink and definitely you will get the result. And if you want to consult me, you can also consult. If you have any query, you can ask in comment section. So I hope you like the video. Thanks for watching my video.